All right, parents, here we go again. It's the Ask Dr. Tony episode. This is the Experience Miracles podcast, and I'm your host, Dr. Tony Ebel, an expert in pediatrics, neurodevelopmental disorders, and drug-free, nervous system-focused healthcare. On this weekly episode, I'll be addressing the top questions on every parent's mind. If there's one thing we love and welcome, it's parents who never stop learning, asking the hard questions, and advocating for your kiddos like none other. So get ready for some real talk, real-life clinical and parenting experience, and real easy to understand answers that will help your family take action and get to that next level of health and healing. You ask, I answer. Let's dive into today's episode. Caring for hyperflexibility and hypermobility with chiropractic. Is it okay? Is there different techniques? So let's talk about some case. Oh my goodness. Not only is it okay, it is so important for our kiddos with Downs, Chiari, EDS, and I wrote it out. I just wrote an article about this. Why can't I say it out loud? I spend so much time writing. Sometimes when I talk out loud. Ehlers-Danlos syndrome, and EDS, and then a bunch of others, okay? There is no clinic in the world chiropractically that has as much experience with hypermobility, which is going to set the stage for what are called the segments and the regions above and below. So the collateral supportive segments and regions of the body and the spine are going to then become hypomobile. If we are having a hypermobility and a hyperflexibility conversation, we are also simultaneously having a hypomobility conversation. Hypomobility, so lack of movement and fixation, is literally neurobiomechanically subluxation. Subluxation stresses out the nervous system. So our kiddos who have, via genetic challenges and whatever it may be, have this hyperflexibility and hypermobility, they then, by what's called neuromuscular compensatory nature, they absolutely have also severe to significant areas of hypomobility and subluxation. So now they're dealing with the challenges that present to the brain and the body and gait and motor and gravitational, security and everything else with the hypermobility. And then they also have to deal with the other side of the neuromuscular coin, which is hypomobility. So here's how it gets really simple. Actually, the nervous system focused subluxation-based chiropractic answer to this with EDS, Downs, Chiari. We see so many Chiari malformation. So that is where the cerebellar tonsors are pulled into the upper cervical. Down syndrome kiddos and different genetic cases will have instability of what's called a ligament up around C1, C2, the odontoid and everything else. So you have to, the question that came with this question is, one, is it okay? It's not only okay, these kiddos need chiropractic more. And I know certain PTs and even chiropractors who only rudimentary understand these conditions. Yes, I had to say what it is. If you only have a surface level understanding of hypermobility and hyperflexibility and certain conditions come with it, then you would automatically throw the baby out with the bathwater, and you would say certain adjustments or not certain adjustments. You would throw chiropractic all the way out. You would say anything that has to do with chiropractic would be just dismissed, full stop for kids with hypermobility. Oh my goodness. That harms kids with EDS and these challenges by keeping them from getting care that they so massively need. So I'm going to get passionate. I'm going to get neurological here with this. It isn't just okay. They need it so much. They need it, you could argue, more than the average bear with not having hypermobility. And then the question within the question with this hypermobility one is, are different techniques required for this? Oh my goodness, yes. So that's where the rubber meets the road. So here's what happens with the subluxation and the neurophysiology and then the chiropractic protocol adaptation for hypermobility. Because certain segments and joints of these kiddos' neurostructural system is going to have the hypermobility, what's going to happen is the areas within the neurostructure, let's just talk about the spine, kind of the chiropractic wheelhouse. We can adjust the cranium, extremities, and everything else, but we'll stick to the neurospinal system. Wherever the hypermobility is, let's say it's in the upper cervical, which is a common place for certain genetic conditions to have this ligament instability, and now C1, C2 are more hypermobile. What happens is the brain, through proprioceptive, sensory motor tracts, the things we talk about all the time with the work we do, the brain is going to, obviously, the cerebellum and the cortex is going to pick that up. And it's going to know, hey, we have instability right here in the upper cervical spine, in the upper neck. Because we have instability here, we need something right above it. In this case, if it's upper cervical, it'll be right below it. We need surrounding structures to compensate. Compensation, fixation. Those two words rhyme. Put them into your brain if this is your family with EDS or hyperflexibility, hypermobility challenges. Now your child not only has to deal with the hypermobility of the segments that have the soft tissue genetic challenges, but now above and below and all around, the body will go through hypomobility and fixation. Fixation, one more word that rhymes with it, subluxation. Subluxation, dysfunction, dysregulation, stress on the nervous system. Now that fixated segment is going to subluxate. That's going to trigger a sympathetic protective response. Now the entire autonomic central nervous system is going to go more into protection mode, fight or flight. And now the child is going to struggle globally, not just segmentally or regionally where the hypermobility is. So to the techniques. So if we know that, that's the sequence of hypermobility. Hypermobility, you have hypomobility, you have fixation, you have subluxation, you have nervous system dysfunction as a result. So that needs to be adjusted. That needs to be cared for. More so than a kiddo or patients who don't have hypermobility, because it's going to continue to need to go back to this fixated state. So that area needs more care chiropractically than anything else. And it needs a very specific way to adjust it. So you have to be able to, in chiropractic lexicon, what we would say with this, you have to be able to mix techniques. One of the things that we've done podcasts about what makes PX Doc's clinical care different. One of the things that makes us very different is chiropractors generally, when it comes to adjusting the way, like literally the kind of neurobiomechanics of adjusting, chiropractors tend to split into two camps. One camp is very light force, very soft, very gentle, especially in pediatrics and nervous system focused care. There's kind of a catch-all term that chiropractors would recognize called tonal, okay? So there's no thrusting, there's no what's called that manual component. It's still by hand. Sometimes there's a little device called an integrator that can be used here, but it's very light. It's very soft touch. We are in PX Docs experts, obviously, in this neurotonal approach. But the other side of adjusting, the rest of chiropractors, the one that probably most of the population is more used to, especially if you watch this on frickin' TikTok or YouTube, do not. See, and if I say it, that's like telling my kids not to do something. They're like, well, now I'm intrigued. So do not go on TikTok or YouTube and look up the ring dinger, okay? Or do, and then instantly know that this is the antithesis and the opposite of what we do in this case. So the other side of the profession, which is not even close to those nut jobs doing that stuff either, is the more manual, traditional adjustment. What kiddos with hyperflexibility need is a chiropractor who is advanced enough, aka a PX doc, in their clinical protocols to have a multitude of techniques. Because where the hypermobility is, that is going to create instability. So all that needs is very light stability creating adjustments. That's a totally different technique and adjusting protocol than we use in the areas of hypomobility and fixation. And it's the latter part that needs the majority of care. And so what happens in these cases is, especially upper cervical instability, which is the most common, what's called their cervical-thoracic junction. So their lower cervical, C3, you could kind of start C3, C4, but it's really about C5, C6, C7, T1. What happens with my hypermobility and hyperflexibility kids is what's called their transition zones within the neurospinal system become so severely subluxated, it really wreaks havoc on their health and neurodevelopment. And so the hyperflexibility, Chiari, EDS, down, special needs, different soft tissue sort of challenges, these kids need neurotonal, nervous system focused PX Docs chiropractic. No, I would not take a hyperflexibility kiddo to a standard chiropractic clinic, right? Absolutely not. They're not going to know where not to adjust. They're not going to know where to adjust. They're not going to know how not to adjust. They're not going to know how not to or how to adjust. They should actually, I say that, and as I say it out loud, like, chiropractically, this is actually pretty nuts and bolts. I actually kind of almost want to retract my statement a little bit. You'd have to be a terrible standard chiropractor to not know in your exam how to find hyperflexibility versus hypomobility, because it's normal with subluxation, because it actually goes the other way too. When you have a subluxated segment or region within the system, that is fixation, that is dyskinesia, disafferentation, and then other areas will become hypermobile as a compensatory mechanism. We see this all the time with our gross motor delayed kiddos, which if we have a specialty within a specialty as nervous system focused chiropractors, it's the neuromotor system. Nobody handles, missed motor milestones, gross motor milestones, and adjusts and handles them better than PX doctors and trained pediatric chiropractors in this way. So I am glad this question came in. We've been getting it a lot. I am actually about to publish an article here really soon too on EDS on our website, pxdocs.com. I'd imagine by the time, if you're listening now downstream, when we repurpose this on the podcast, it'll be there. If you're on with me live right now, that article may not be there, but we'll put the link in along with the podcast when it goes out and make sure that is up there. But I'll put a recap to it. If your child genetically, which is usually where this comes into play, has hyperflexibility and hypermobility, it is not only okay to get your kiddo adjusted, it is absolutely essential from a neurological standpoint for them to be adjusted. They are more likely to be subluxated. They are more likely to be more severely and significantly subluxated, so they respond to neurotonal, very specific types and techniques of chiropractic very well. So your kiddo with hyperflexibility and hypermobility, or you as an adult, you really need chiropractic care, and you really need a very specific technique and approach to chiropractic care. The insight scans, especially the EMG patterns and stability metrics, would come into play big time with this one. So if this is you or your family or your kiddo, be sure to get under chiropractic care. Don't let anybody scare you out of it. If a chiropractor says if you're on Instagram, Facebook, wherever, you go to an orthopedist, by the way, asking an orthopedic or a pediatrician or a neurologist about chiropractic, it's kind of my analogy I was talking about before. It's kind of like asking an accountant, what you should do with your car, or gardening questions. Like, people have specialties and then they have things that aren't there. Like, medical doctors don't have a clue actually about how chiropractic works. All they have is hearsay and skepticism with no scientific basing. Like, they're usually throwing darts, and they're dangerous darts, because if they scare people out of care, then people don't get the care they need. And that's a big issue, actually. It may sound like just kind of a little bit of a sidebar or a tangent, but it's a really big deal. When my patients ask me questions about something I don't know anything about, guess what I tell them? I don't know anything about that. I can't help you there. I don't have a good answer. I only respond and work with our patients in our platform through 100% truth. If I don't know it inside and out, because I'm educated, experienced, do it, and again, didn't just take a class, but I actually have real life experience through it, you're not going to get a half-assed answer from me. You're going to get a real answer that says, I don't know the answer, let me get you to somebody who does, or I don't know the answer, let me go do my homework and come back and help you there. Not a lot of other doctors and providers do that. And I see all the time on Instagram and Facebook, and I've heard all the time from our EDS and other sort of patients that they ask their orthopedist, or they ask their pediatrician or neurologist, or they ask their PT, about chiropractic for their kids with hypermobility, and these misguided, I'm sure well-intended, but misguided, don't understand the neurobiomechanics actually at all sort of providers. I shouldn't say at all. They don't understand it fully. Will put the fear of God in families to not get their hyperflexibility and hypermobility kids adjusted. And I'm going in overtime with this answer because it breaks my heart, because those kiddos subluxate, they fixate, they get into neurological trouble pretty quickly and pretty easily. That's why they have a lot of instability, emotional dysregulation, digestive problems, respiratory and immune challenges. Holy cow, can we help with all of those things massively in those kids? Because if they have hypermobility, they have hypomobility, they have subluxation, they have nervous system dysfunction, probably at a larger degree than if they didn't have the hyperflexibility. So we're not going to mess with that. We know it's kind of chiropractic 101 to not adjust a hyperflexible, hypermobile joint. I mean, again, you'd have to be a chiropractor in a van down by the river, drinking Jim Beam all day to not adjust a hyperflexible state. So if anybody says that we can't, they don't know what they're talking about. All right. So get those kiddos in for care, and to be particular, get them into a neurologically focused advanced chiropractor, just to be sure that you're getting the best care that is most effective and most safe. Thank you for tuning in to today's episode. Do you have a question that you would like to submit? Either send it to support@pxdocs.com with the subject Ask Dr. Tony, or head on over to our socials @pxdocs, where you can submit your question in our stories every single week. Every kid counts and every family counts, so let's leave no questions left unanswered. If you loved this episode and you want to help us reach more kids, we would so appreciate if you left a review and a rating on your favorite platform. God bless. Be well. We'll see you on the next one.